7, they served their country, putting their lives at risk for our freedom. Now, years later, many veterans are learning their service may have put their health at risk, too. But one local hospital is working to find lung cancer in veterans before it's too late. Our TV6 reporter Tanya Spencer has details.
Where they had us in Saudi Arabia, we were very close to the Kuwaiti border, and we were in very close proximity to one of the many oil platforms that the Iraqis torched.
Pictures Colonel Mark Smith took during his deployments during Operation Desert Shield and Desert Storm show the story. Skies were blue when the Marines arrived, but dark with black smoke after oil fields were set on fire.
Probably spent a solid 3 weeks of doing nothing but, I mean, breathing black soot in and out of the mouths. We joked at the time. We all knew it was going to kill us one day. You know, we claimed it would be our generation's Agent Orange.
21 years later, Smith, who has never smoked, was diagnosed with lung cancer, a cancer that kills more people than breast, prostate, and colon cancers combined, and is killing more and more non-smokers.
Lung cancer is the #1 leading cause of death in all cancer patients, all comers, men and women. And we realized that majority of these patients at the time of diagnosis are already advanced stage. We call it stage 4.
Dr. Nadim Iqlaq stresses the importance of early detection. And since veterans are more than 25% more likely to develop lung cancer than civilians, Franciscan St. Francis Health is offering free low-dose CT scans to high-risk veterans. Smith would not meet the criteria, but has this advice to fellow service members.
But I would tell any veteran that's deployed to Afghanistan or Iraq, sit down and talk with your doctor. Explain to him where you've been, what you were exposed to. And it may cost you $300, but better $300 than 20 years later and you're stage 4 and there's no hope.
St. Francis is one of only 14 medical centers in the nation offering the free scans, and the only one in the state. They're offering the free scans through the end of November. Reporting at St. Francis, Tanya Spencer, RTV6.
To qualify for the free screening, you have to be a U.S. veteran between 55 and 75 years old and have to have been a longtime smoker within the last 20 years. Smith hopes those restrictions will soon be loosened to include non-smokers.